Hey everyone, it's Dr. Hodges, and today I want to do a little quick get ready with me and talk about how you can be a success when you're about to have surgery. I want to talk about what to pack, what you need to do the week before, so all the little insights. And I know that you're going to do really, really well if you can get some of these things done beforehand. So let's get into it, okay? So let's talk about the things you need to do probably 1 to 2 weeks prior to your surgery. So everybody's going to have a preoperative appointment that they will attend at some point. In my practice, ideally we do it 2 weeks before, because at that appointment, you're going to receive your post-op medications. Now, not all doctors do that. In my old practice, when I first got out, we didn't do that because at that time, the senior partner was concerned that people might lose their pain medicine. I have to be honest, since I left that practice and I've been on my own, I've just found it much more efficient to give all your post-op meds at that time. And I haven't had a lot of pain medicine loss. So kudos to you guys. I've also found whenever I'm doing all my post-op meds, it can take a while because a lot of the medications that I use, well, not a lot, but a couple of them that I use, they're liquids. And so pharmacies sometimes have to order out for those. And I just want to make sure that my patients have their medications prior to their surgery. Also, about 2 weeks before, and you need to check with your anesthesiologist and your surgeon, if you take a GLP-1, so if you're taking Wegovy, if you're taking semaglutide, if you're taking Mounjaro, Ozempic, I'm trying to make sure I get them all, tirzepatide, Zepbound, the new weight loss pill, if you're taking any of those things that they take like at least a week in your system, you need to make sure that you are off of them for at least a week. Now, every anesthesiologist, they have their own recommendations. Sometimes they want you to be off of them for 2 weeks. So that's almost like 3 weeks. And I say that because remember, the medicine lasts for a week in your system. So it would have to be off 1 to 2 weeks after when your next dose would be. Does that make sense? So definitely check with your surgeon, because those anesthesiologists, they have no problem canceling your surgery. Okay. And that is completely out of the surgeon's hands, because we have to have somebody to put you to sleep. And believe me, you want to be asleep. We're not going to do the surgery with you wide-eyed and bushy-tailed. So check with your doctor if you're on one of these medications, if you need to come off. That also, now this is not for bariatric surgery, but I know if I have a patient and they're about to undergo like plastic surgery and they're on phentermine, a lot of times the plastic surgeon will want you off the phentermine like a month before and a month after. And with some orthopedic cases, they want that as well. I also know with some orthopedic cases, they also have these recommendations about the GLP-1. So please, please check with your surgeon, because you don't want to show up to your surgery date. I'm telling you, they will have no problem canceling your surgery. And remember, you've now been on a liquid diet for at least a week or so before, and that is no fun. And you've taken time off from work and put in for your FMLA and blah, blah, blah. So they will cancel, okay? I'm telling you right now, so don't get mad at them. All right, so what else should you do? Well, if you already have a surgery date and you've already been approved, then that means that you've already gone through your nutritional counseling for your pre-op and post-operative diet. I recommend that you go ahead and you get all of and you don't have to buy loads and loads of it, but I do recommend that you go and get at least 1 to maybe 2 weeks worth of protein drinks. But don't go buy, if let's say Costco is having a sale on Premier, please don't go there and buy like 8 cases, because I will tell you, even if it is a really good price, because sometimes after your surgery, your taste buds will change a little bit. And you don't want to end up with boxes and boxes of a protein drink and you're like, oh my gosh, this is really sweet. I don't want to drink this now, because now you've wasted some money. And that is not uncommon. It's not usually something that lasts forever, but just know that your taste buds can change. I kind of tell people, I'm like, it's going to feel like you can smell a gnat fart from a mile away. And it's almost, that's how I was whenever, like in my first trimester of pregnancy, I was super sensitive to smells and tastes. When my mom had her bypass, she stayed with me. And that was the same. It was right before Christmas. And I remember making Christmas Eve dinner. She's like, I got to go upstairs. She just couldn't handle all the smells. So just kind of keep that in your mind, just a little food for thought. All right. But I do recommend that you get your protein. I also want to make sure that you guys are getting your, get all of your vitamins. Now remember, if you were a bariatric patient, you've heard it here, but I know that you've also heard it if you're using insurance. You've heard it from the nutritionist. And I'm saying this because sometimes folks will show up to the ER, they're a year out or 2 years out or whatever, and they're like, nobody ever told me I had to do protein. Nobody ever told me I had to do vitamins. I'm like, that is a lie. You are lying. That is not right. And I say that because for you to have surgery, you have to speak with the dietitian. It is required. Insurance will not cover your surgery. You have to have a dietitian visit. And each and every time they go over your post-op vitamins. So I recommend that you get your vitamins. I'll have a link below. I really like the vitamins from Bariatric Advantage. There are lots of good vitamin companies out there. Bariatric Fusion is really good as well. But I really like Bariatric Advantage. And what I like about them is they have an all-in-one. And it's a complete vitamin. So I think there are some on the market that some of my patients have gone and told me about. It's like Sister Rachel's or Sister Sue or something like that. Nothing against Sister Sue or whatever her name is. I'm sure it's a great vitamin. It's just not a good vitamin for a bariatric patient because it does not have all of the nutrients that you guys need to be good growing boys and girls that just had weight loss surgery. Okay, your vitamin needs are going to be a lot higher, and so you're going to need to do extra vitamins and extra micronutrients. There are a couple of all-in-ones from Bariatric Advantage that I really like. I really like the Ultra Solo. It is 1 capsule once a day. I also, however, if you do that one, you have to know that during the 6-week post-op diet, because it's a big capsule, you would have to open it up, and you might not want to do that. So they do have some chewables. The Ultra Solo also comes in a chewable. So I usually recommend for the first month. Oh my God, what a lot of. I'm washed out on this screen, but on my real mirror, oh my God, these big old pink cheeks. Ultra Solo, it does come in a chewable, but it's great. It's your multivitamin, iron, B12, and vitamin D, and once a day. Everything you need. And the only thing you need to add to it is calcium. And Bariatric Advantage, they have really, really tasty calciums. Really tasty calcium. I love their calcium. They also have a really good one that is called Advanced Multi-EA. And with that one, you take 2 a day. And that comes in a chewable. They do have other multivitamins available. They have a multi-chewy bite. The only downside with that one is that you still have to do B12. You still have to do extra iron. You still have to do some of these other ones, like other micronutrients. And if you're just looking for ease of use, and if you're looking, and that also is going to lend itself to being less expensive, because I think the Ultra Solo, I think that one's like $23-24 for a 1 month supply. And that's everything that you need. So something to think about. But regardless of the vitamins that you select, you need to have them, and I would get them pre-operatively. I don't want to see you in the OR, or pardon me, I don't want to see you in your hospital bed and you're on Amazon trying to scrounge up some crappy vitamins. Please do not do that. Not to say that Amazon doesn't have good vitamins, but you get my point. Get them the week before at least, okay? And I'll have some little links below for my top picks for vitamins. Also, you are going to get your, you have your vitamins, you have your protein. I recommend you get your water. The week before, every surgeon is a little bit different, but in my practice, I have you do a liquid diet. It can be full liquids, it could be clears, but I have you do that a week before your surgery. So nothing with lumps or bumps. Please strain it. I did have a lady that had gastroparesis, meaning her stomach was slow. She had been off of her GLP-1, oh my gosh, for a month. But when she was doing her liquid diet, it had onions in it. And how do I know it had onions in it? Because when we went to intubate her, it all came up out of her stomach. And she had been compliant. She was off of her GLP-1. And she was, well, I guess she really wasn't compliant. And she had been doing liquids, but it wasn't strained. And so all these onions, like little small pieces, like came up. Nothing with lumps or bumps. You would pretend like you have no teeth. What would you give a baby? You wouldn't give them soup with onions, okay? So give us this time so that your body can get right. You want to be prepared before surgery, and then after surgery, you want to make sure that you're sticking to your post-op diet because you don't want any big complications. So soups, nothing with lumps or bumps. You like potato soup, stick it in a blender, make sure it's well blended. You like broccoli cheese soup, stick it in a blender, make sure it's well blended. You kind of get the drift. So that is what you will need to do. Ooh, I got a little splurge right there, hang on. Now that you have gotten all your soups for pre-op, okay, and for, at least in my practice, for 1 week after surgery, you are going to be on clears. That is like broth. So you can do the broth from chicken noodle soup. You can do the broth from French onion soup. You can do the broth from pho. You can salt, pepper, zhuzh it up. I do not care. Go for it. I would go ahead and get all of your soups, all your spices, all your protein, anything that you need to ingest, all your water if you want to do protein 2.0, if you want to do your pre-made protein drinks, all of those things. I would go ahead and get all of that purchased a week before your surgery, at least, okay? So you now have, and we're going to keep on doing these recaps. So you're now going to have your pre-op prescriptions or your post-op scripts. You're going to have your vitamins. You're going to have your protein. You're going to have all the food for your diet for the week before and the first week after your surgery. The next thing that I want you to do, if you are my ladies with pretty nails, you need to go have those things taken off, okay? Because we have to put a little device on your finger called a pulse oximeter, and it is going to give us your heart rate, but more importantly, your oxygen levels. And who cares what's going on in your belly if there is no oxygen floating around in your body? And if you have your pretty Valentine's nails or big, and especially if it's a dark polish, we are not going to get a good read. And then sometimes you have to stick it on your ear, and then we're futzing with it all through the surgery and all that. Like, please don't. Just take them off. What you should do is a week before your surgery, you need to go and pamper yourself and get your nails soaked off. Get one of those Russian manicures where they do all this special cuticle treatment, buff your nails. No nails. Please just take off your nails. It just makes it a lot easier, okay? And then finally, what I want you guys to do is get ready to pack your bag. And I have a separate, I'm looking for my lip liner. I have a separate video on everything that you need to pack in your bag, but some of the highlights are going to be bring a good lip balm. I just got this one, and it's so good. This one's good. Lanasia's good. Where's my, oh, this one I love. This one, I love it by Clinique. Love, love, love. One of the complaints that I get from patients is that they have really dry lips after surgery. And so if you use a lip balm, it can really help. You do not have to buy an expensive lip balm. You can go get some e.l.f. from the drugstore. The biggest thing, pardon me, that I would tell you is just get a lip balm that has no flavor. Okay? If it has a mild minty flavor, that might be okay. But I would definitely get one with no flavor. Okay? Because again, your taste might be heightened, and you might be really sensitive, and it just might make you feel a little nauseated. The other thing, bring some house shoes. I would also load up. I would bring a house coat, house shoes. You do not need to bring all your prescriptions with you. If you have questions about your post-op scripts, you can bring them in a bag, but you don't need to bring any of your home medicines to the hospital. Bring toothbrush, toothpaste. Oh, and bring an extra long phone charger, because the plug is going to be behind you in the bed, and those hospital beds are big. So don't bring a little short charging cord. You need to get one of the really long charging cords. Okay, that would be the thing. But check out my video that I have for your packing list, because that will be really, really helpful. And yeah, I think that's it. So stick with your pre-op diet, pack your bag, get off your GLP-1, get your vitamins and protein, and I think you're going to be good to go. I'm excited for you guys. I know I pray for all of my patients. I really, really want you guys to do well. And even if you're not my patient, I wish you, and I truly, truly wish you all the very best. I just want you guys to be a success.